c'est, on va voir combien de personnes. Celui-là, le panneau de configuration. Ouais. Est-ce que je dois commencer?
Non, juste si vous voulez, en fait, faudrait, ça serait mieux si vous ne l'ouvrez pas.
OK, je l'ouvre pas.
On va juste le laisser fermer. Ouais.
OK.
C'est bon, puis ça, on peut le fermer ici.
C'est mieux de juste tout garder fermé?
Ouais,
OK.
Ça.
OK. Et tu me dis à quel moment je dois commencer? Je peux commencer? Non, ils peuvent pas. OK, alors là, est-ce que... Alors, lorsque je vais commencer, qu'est-ce que je fais? Mais les gens nous écoutent? Ah bon? Hello, everybody. Welcome to this webinar on finding housing for the Syrian refugee newcomers in Canadian cities. I would like to thank everybody for joining us online in this webinar format. We're coming to you from the Quebec Inter-University Centre for Social Statistics, which normally hosts presentations that are based on qualitative survey and census data. And this today is qualitative data. Census data and survey data are also used to research settlement and integration issues, and hopefully such resources will also be used in the future by some of you and by researchers to track the progress of refugees in Canada, including Syrians. But what we're doing today is based on qualitative research on how things worked out for finding housing for the Syrian refugees in the first year. So I'm not quite sure how many people are online because I can't see that panel. A lot of people registered from all over the country, and there are also some people registered from Montreal. They're not in the room, unfortunately, but I know they're here. Alors, bonjour aux participants montréalais. J'espère qu'on va avoir l'occasion de discuter avec vous de cette recherche à vive voix à un autre moment. I also just want to mention that some people who I hoped would be here are not well represented, and it was because we weren't able to make the connection with housing providers through the Canadian Housing and Renewal Association in time, because our organization of this event and our sending out the mailings coincided with their annual conference. And so people online, those of you who have contacts with your local or regional or provincial housing providers, if they're not online, spread the word about this research, about the webinar. We are going to be archiving the webinar on YouTube afterwards, and everybody who's registered will get the links, so you'll be able to listen to it. So the plan here will be to present for about 45 minutes, and after that, there can be questions and comments through the webinar chat log format. Our technology here is not really robust enough to give everybody the virtual microphone, but at least you'll be able to ask questions through the chat log. The presentation will take the kind of classic form. We'll start with the research context, questions and methodology, the main findings, and the takeaways so far. Our analysis is still quite preliminary. Every time you do a presentation, it changes a little bit, and it's becoming less preliminary. The takeaways are probably still the part that's still a little bit more preliminary, and they may evolve a little bit as we get further comments before we write our final report. So this research is funded by the Social Sciences and Humanities Research Council of Canada under what's called a Rapid Response Program. And it's with the participation of Immigration, Refugees and Citizenship Canada, who have co-funded this initiative. And it's a way to generate short-term research on key issues and events in the early days of the resettlement process in the hope of trying to understand what was special and important about the Syrian operation, and also what lessons can be learned that can be applied to other larger scale refugee settlement operations. And the funders really wanted short-term studies that could be made use of in a practical way fairly soon. So we got the funding at the end of the summer and last summer, and we're trying to get it finished by the beginning of July so that it will we can then put out shorter summaries when people come back from the summer vacation in September. So that's our time frame. Why we did this study? I can begin with a couple of quotes from people that we interviewed in this study, but are similar to things that people have said in previous studies. The fact that you need to have stable housing in order to begin to organize the rest of your life, in order to recreate an ordinary situation. You need it for practical reasons. It's difficult to get your kids into school and to get a family doctor and do all that other stuff until you get permanent housing. And then there's also the sense of safety, the sense of inclusion, making connections, and the sense of, the symbolic sense of security. Somebody said that first apartment is the first place that they are safe. They might also feel safe in their first temporary housing, but the accommodation, but the permanent housing is kind of the clincher for that if it's decent housing. There's been quite a bit of previous research on newcomer housing experiences in the past 15 years or so. A lot of it was funded by the federal initiative with provincial and municipal support called the Metropolis Project. So it was found that all refugee categories, entry categories, face greater barriers than other entry categories, but over a few years they do tend to catch up if they're given the appropriate chances and opportunities. There were a batch of studies that compared within the refugee group, refugee claimants who were waiting for status, compared to government-assisted refugees and privately sponsored refugees. And there were some studies that concluded that refugee claimants, because of their immigration status precariousness, were in the most difficult situation of all, and that there wasn't a lot of difference between government-assisted refugees and privately sponsored refugees. Now, things have changed a little bit since that batch of studies was done. And first of all, recent longitudinal data from IRCC indicates that private sponsored refugees are doing better in the short term. They're kind of pulling away from the government-assisted refugees in terms of their progress. And the other thing is that there was a new Immigration and Refugee Protection Act, which in the jargon is called IRPA in 2002. And this led to Canada admitting a higher share of government-assisted refugees, whom we call GARs in the jargon, in case there's anyone that doesn't know that. A higher share of government-assisted refugees who have higher needs. So what we mean by higher needs is higher medical needs, complicated and large family configurations, a lot of children, or the accumulation of multiple difficulties to shorter term to ease of settlement, a long period of time in dislocated refugee camp situations, for instance. Now, as a result of that, this chart, which was taken shamelessly from a presentation by IRCC in the plenary of the Metropolis conference in March, this shows, using IRCC's quantitative data, administrative data, that if you take the people who arrived as government-assisted and privately sponsored refugees from 2003 to 2013, and you look at what happened after 1 year since admission, what happens is that you see that at 1 year since admission, over 90% of government-assisted refugees are still living on income assistance, and a much lower percentage of privately sponsored. The dependency on income assistance does go down quite steeply between year 1 and year 2, and it continues to go down, but it goes down more gradually. And with that, the percentage that have employment earnings will increase. But the important point is that especially since the 2002 ARPA, language training needs, family responsibilities, and overcoming health challenges all contribute to the longer average time for employment rates to exceed income assistance rates for government assisted. So the key point here is that income assistance plays a key role. It's essential for the early years of GAR resettlement. But the paradox is that provincial social assistance principle is that income assistance is a last resort only intended for short-term use, but you have a group of people that need it over the longer term. And this is an issue that will come up over and over again in this presentation, as it has done before, in terms of the implications for solving housing issues, especially for government-assisted refugees. So we also wanted to undertake this study now using the case of the Syrian refugees, because it's been almost 20 years since the last large-scale refugee arrivals with the Kosovars in 1999, and this is the biggest large-scale, the biggest arrivals since, I believe, the Vietnamese boat people, which was in the late 1970s, early 1980s. And urban housing markets, especially in high-growth urban regions, have really changed since then. There have been big rent increases, especially in the past 10 years. And for the past 20 years, there's been a lack of investment in new affordable housing. And overall, regardless of your immigration status, there is an issue in regards to housing affordability for people who are poor. They're either poor because of being on social assistance or poor because they're earning minimum wage. For government-assisted refugees, there's a particular issue with the inadequacy of the Resettlement Assistance Program, or RAP, income assistance. Now, there's also an issue, there could be also an issue for privately sponsored refugees, because the groups that sponsor them can't necessarily afford to provide financial help over and above those social assistance rates. But we don't have as much information about that, as we'll see as we go on. There are research needs to do more to follow what happens with the privately sponsored refugees over the first year, which is not something we could tackle very much in this project. The income issues have especially been for large families and single people on their own within the government-assisted refugee group. Okay, I think it's important to take a couple of minutes and consider what aspects of the Syrian refugee operation were unusual. Not all of them. Some of them were. There were no orientations programs before arrival due to time constraints. The pace of arrivals was very uneven and it was very unpredictable. There was a very high volume to some destination cities over a very short period of time among the government assisted. And also there were a large number of privately sponsored refugees, and there was a lot of uncertainty about when they were going to arrive, and there were rushes and then periods when nobody came and more rushes and so on. And then the other thing that was different was, even though the research community and the settlement community knew perfectly well that overall GARs arriving since 2002 generally had more higher needs, nobody was prepared for the very high rate of high needs among the Syrian group, and that information didn't really start to become understood until people had already started arriving. So there was a very high number of very large families with young children. There were some very major health issues and some significant literacy limitations. So however much material you distributed in Arabic, some people couldn't read it. So there were some communication barriers that only came to be realized as time went on. It was still a very diverse group, and we can't generalize, but there were significant numbers of people that faced those additional types of barriers. This is more data from IRCC. This is published online in the open database. So when we talk about the arrival of the numbers of refugees, usually it's talked about in terms of individuals, but people who are involved in providing housing, they need to know about households, because one housing unit is needed for each household, and households have different sizes. So it's important to look at the household data. Now, the way that IRCC defines families, it's in terms of the groups of people who are migrating at one time in one group. It doesn't map on exactly to a household as forming an independent housing unit in Canada, but it approximately maps onto it. So we can immediately see that when we look at families or households resettled, there aren't as many, overall for the whole of Canada, there are more privately sponsored households, refugee households, than there are government-assisted refugee households, but the GAR households are larger. So it's important to look at those two sides of it. When you calculate the family sizes, in fact, the privately sponsored family size for the group captured by this this data file, which is the people that arrived up until July 2016, household size for privately sponsored is 2.27. Average household size for government-assisted refugees is 4.85. Using the same data source, you can look at the variations in household size by entry category, and you can see immediately, I won't go into all the details, but there are more large families and even very large families among the government-assisted refugee, and also the blended sponsorship, which is a hybrid category which does include some people with very high needs whose settlement is shared by private individuals and groups and the federal government. Whereas the privately sponsored refugees form much smaller households. And this compares with the fact that with admissions of government between 2010 and 2014, which had a lower proportion of very large families and a higher proportion of one-person households. Some of the organizations that we interviewed were gearing up to house majoritarily single people, and they found that they ended up being asked to settle a large number of large families. So there were some surprises and some rapid adaptations that had to be met. Our research project, we mainly focused on Syrian government-assisted refugees housing process throughout year one, and especially in the first few weeks. And our secondary goal was to identify issues for future research, to start a conversation about future research concerning housing of privately sponsored refugees. With the resources and time for this project, we really couldn't do both groups in a significant way. So we decided to focus on the most urgent priority and also what was the most feasible in terms of available data and people to interview. So the way we phrase our main research question, we're focusing on what's going on in different cities. So how did the local social infrastructure, as we call it, deal with housing-related aspects of Syrian refugee arrivals in different cities across Canada? The impacts of size, different city size, the state of the local housing market. So what we mean by local social infrastructure, it's the set of resources, people and things and networks in place in each city and the way that they interconnect to support newcomer resettlement. So this includes formal organizations, partnerships, and also the more informal groupings and temporary groupings and the volunteer outpouring, if that was integrated into the whole process, that sprung up to help with the Syrian operation. So in each city, the centerpiece of this local infrastructure is comprised by the community-based newcomer settlement organizations, many of which have people online today. And a subset of those organizations holds the contract with IRCC, or in Quebec with the MIDI, to deliver the resettlement assistance program called the RAP to GARs in usually the first 6 weeks of their arrival in Canada. So the shorthand for the organizations that have the resettlement assistance program contract, call them RAP SPOs, so SPO, Service Provider Organization. So these RAP SPOs also deliver other newcomer settlement programs, and they have various different sources of funding for the other programs they deliver: federal, provincial, municipal, United Way, you name it, they have that funding. And some of the organizations also serve not only newcomers and recent immigrants, but they have intercultural activities for the whole community, anti-poverty programs for the whole community. At the start of the Syrian refugee settlement operation, there were 23 RAP service providers in provinces under IRCC jurisdiction, and there were another 13 delivering Quebec's version of that program. 6 new RAP contracts were set up during the Syrian operation. What RAP service providers do: information orientation for all the administrative logistics that any newcomer has to deal with, life skills training and social support for the first steps in resettlement, and it's specialized, taking into account the particular needs of refugees. Getting people into temporary accommodation, finding it and making it work smoothly, and then a lot of assistance and accompaniment finding permanent housing, and then referrals to language training, employability, and other settlement assistance that people continue to need after they have received their RAP training. So those people may or may not go on to receive further assistance within another branch of the same organization, or they may go elsewhere. But the point is that there's a referral and connection process that's made. So for privately sponsored refugees, private sponsor group are supposed to cover all those aspects and also cover 12 months of financial support, which for the government-assisted people is covered by the RAP allowance. This pretty program, this pretty chart recaps our research questions about the local infrastructure. How did the process of permanent housing unfold in different places? Common experiences, significant differences. What were the challenges, resources, and successful practices, and what lessons can be learned? So this diagram summarizes what we did and the different points that we analyzed. So we had 3 main sources of data. We interviewed RAP providers in 12 cities across Canada, well actually 11 plus 1 in Quebec for the Quebec version of the program, which has a different name, but it does the same thing. And we also try to start finding out about issues for housing for privately sponsored refugees by talking to a few key informants in Montreal. We haven't quite finished that process, so we hope to get 1 or 2 more interviews. So those interviews, which range from 40 minutes to 2 hours, are really the core of our body of data. But another very important aspect is we collected over many months press files for all the local and national media coverage organized by each city and organized chronologically. For each city that had really at least 50 refugees that arrived. So we have a lot of the media coverage from all the cities where we did do interviews, but we also have it for the cities where we didn't do interviews, which we're going to be integrating as much as we can into the final report. There were 2 sets of parliamentary hearings that took place last spring, both at the Senate and the House of Commons, and we've analyzed all the evidence to those hearings, and that data source has particular weaknesses, but also it is interesting and useful in some ways as a complementary source. So the issues that we're examining are advanced preparedness information about arrivals, temporary living arrangements, the challenges and the resources, and that ended up taking up quite a large portion of some interviews because we spoke with some RAP providers who had some people in hotels for a long period of time, and they really wanted to talk about how that process worked. And so we will be including that in our final report, even though it's not strictly housing. There's a difference between the concept of accommodation and housing, at least in English. So, but we were definitely going to include that piece. The biggest piece is obviously challenges and strategies and help around permanent housing. We also explored the issue of stability of housing and what about this looming month 13 issue, which was going on while we did our research. And then every time somebody talked about private sponsorship, we flagged that and to try to begin to develop a research agenda for private sponsorship, even though it's very uneven, the information that we have about private sponsorship. Because the way it worked out was some of the RAP providers that we interviewed are in organizations that are also sponsorship agreement holders, and sometimes they were able to speak to us about some of those issues for private sponsors as well. And then we considered what our informants' views were regarding key issues and recommendations. So these disconnected boxes here are all the things that we then connected to all this other information. So what city was it? Did the information come from the people that the cities where we did interviews, or did it come from the cities where we didn't do interviews? Because when we didn't do interviews, we don't have as many different perspectives, so it's less in depth, but we're still using the information. The local housing market context. Are we talking about government-assisted refugees or privately sponsored or both? And then what's the positioning of the informant? Who are they? Are they a RAP provider? Are they from some other settlement organization? Are they from a volunteer organization that came and spoke to the parliamentary committee? And if it's media, who is it? Is it the Global Mail and the CBC, or is it, or is it the Weekly from the region? And it's different types of information. So we're trying to integrate all that into an integrated database. The project timeline, very briefly, data collection we did last fall, began last fall and continued into the early spring. The interview part of it was done between January and March, with a couple more interviews that might be done around now. And then we began the analysis. We did a conference presentation at Metropolis. We sought feedback with the people that we interviewed in 2 online group meetings, and it was absolutely amazing. We almost everybody was able to attend, and we have the transcripts from those meetings now, and that provided a few additional pieces of information that helped us interpret some of our findings better than we had done before. Now we're at this webinar stage, and then we're moving toward our final report, which we hope to finish by early July, and then do summaries in September. I hope you can all see this chart, which has generated a lot of discussion, and it was very central to our how we selected our cities. And what we did was we took the data that IRCC kept on posting online month after month in terms of the arrivals and where they were landing, and we did that until September. And then we reorganized all the information that was provided by separate communities so that we would have it by metropolitan areas. And then we related it to the housing market data provided by Canada Mortgage and Housing Corporation. And because we knew there was going to be this issue with large families, we took the average rent for a 3-bedroom dwelling. So what you see here is what was the contribution of each Canadian metropolitan area or census agglomeration, urban area, to the overall refugee effort within Canada. And sometimes that correlates to the size of the cities, and sometimes it doesn't. You have Toronto up here as being, the largest city in Canada and also contributing by the largest effort. But Vancouver made a disproportionately large effort relative to its size, and Montreal, for government-assisted refugees, made proportionately a very small effort, but Montreal was pretty well the largest receiving city for privately sponsored refugees, followed closely behind by Toronto. The housing market data for October 2015, which is a month before the Syrian operation started. Now, the situation for rents has changed a lot in a few cities since we did this, and it's important to point that out. Windsor is no longer at the lower end of the rent scale. Rents in Windsor have gone up a lot. Also, Kitchener-Waterloo and Halifax and I think Peterborough from memory. So, but at the start of the process, this was the situation. But it changes over time. But we use this in order to help us decide where we wanted to do interviews, because we want to do interviews in the housing markets where things were tougher and where there were a lot of people, the housing markets where things were relatively tough but where there weren't as many people necessarily, and then the kind of in-between markets, and the housing markets where that had relatively high vacancy rates and low rents, which might in some cases have had a lot of people, like Windsor had a lot of people. Gatineau didn't have a lot of people, but it was the second largest number of government-assisted refugees for Quebec, so it was a larger effort than normal, and so on and so forth. This was very central to our whole process. Moving on to our main findings. This is selective, but we're kind of getting closer to thinking what are the key issues that are going to be in our final report, and so we consider this as kind of a draft table of contents for the report. So the first point is many people talked about this, the fact that well before the operation started, different organizations got together in the different urban areas to aim for what one interviewee called aiming for advanced preparedness for just-in-time planning, which we found to be a particularly felicitous phrase. And sometimes that worked, and sometimes things happened. And there was somebody from IRCC, I think, also who presented at the Metropolis Conference, and she said, there is a plan until there isn't. So that kind of says the same thing in a different way. So pretty well everywhere, cities or urban regions set up multi-stakeholder, multi-sector tables, and they help to plan, among other things, for temporary accommodation and for permanent housing. So they worked on consolidating and increasing the effectiveness of existing capacity. They tried to develop new capacity where they felt there wasn't enough. Sometimes there were misunderstandings and difficulties that arose because municipalities or provinces came up with new programs and new timetables, not really knowing enough about what was going on already. And so over time that was worked out, but sometimes it produced a few hiccups. There was there's an eye missing here. It became evident there was a need for better planning as to how to integrate volunteer and community initiatives, which wasn't necessarily thought through in advance. There was some debate in some cities about, are we running our emergency planning model here, or are we just scaling up normal settlement research? And there was a big debate in that about in a couple of cities, because there's a difference between doing crisis management and just doing what you do normally, but doing more of it and in a shorter period of time. And there's probably going to be a long ongoing discussion about that for future operations. An important aspect, when you see a check mark here, it's our provisional view on what's a good practice or best practice. That could also evolve, but these are the ones where you see check marks are best practices that just leapt out at us when we were analyzing the interview data. So early buy-in by landlord associations and other housing providers had major positive impacts later on. People who are outside of the resettlement program assistance community don't necessarily know that those organizations and other local settlement organizations have been doing this for years. They've got long-standing relationships with housing providers. So this was not a new process for the Syrian refugee operation, not at all. But it was a question of reinforcing those relationships and trying to use those networks to get new housing providers on side. Most commonly private landlords, but also new relationships developed with non-profit housing providers and even with public housing authorities in some provinces, notably we heard about in British Columbia and New Brunswick, maybe elsewhere as well. And people said that this process of consolidating existing capacity and figuring out the right way to build new capacity has lasting impacts for future occasions in terms of networks and information sharing. The big thing that's in red here, this won't come as any surprise to anybody, but we're just applying it to housing. Insufficient advance notice about government-assisted refugee family profiles and about their arrival timetable. Among other things, this had limits to what could be done in the cities for housing readiness, which meant that there was just-in-time placement without enough of the advanced planning that would have happened in an ideal situation. The hotel stays grabbed the headlines. And for a while there was bad press about this and people doing damage control, trying to explain why it was happening and so on and so forth, and maybe some exaggeration of the extent to which it was happening, because long hotel stays only happened in a certain number of cities. But it's still an important issue to talk about, and it was very important in some of our cities. So the main reason why it happened was the pace and volume of arrivals in tight housing markets, especially in the early phase of the operation, combined with the issue of unanticipated family configurations and special needs. So to do with this pace and volume of arrivals, there were several types of delays in administrative ramp up, meaning the channels of communication that started before and logistics that started before people arrived and then went to the federal government and then down to the regional and local levels. So one issue was the timing of getting additional resources to the RAP providers for training housing search workers. That came up quite a few times. Came up less often, but was an issue because it was unfortunate. It wasn't easy to find housing, and sometimes the right housing was found in the right place, but it wasn't found at the right time because the check hadn't arrived, so the lease couldn't be signed, and so that housing was lost. There were a lot of logistics around getting furniture, which I won't go into now, but we will mention in our final report. There is a furniture subsidy for government-assisted refugees, but there were a large number of them, and there were issues of coordination, and it was done differently in different parts of the country. There's an issue of managing expectations, which comes out in a bunch of levels, including delays in getting out of hotels. It was a matter of principle and policy to try to give refugees some choice about housing, and sometimes they balked at the first couple of offers that were made to them, and sometimes it was because of cultural misunderstandings relating to this lack of pre-arrival training. If you come from a country and a culture where when you get a house, it's a house for life, you're not going to want to accept the first accommodation that's offered to you if you're not used to the idea that in Canada and in Quebec, people move. There's this concept of the housing ladder. And I know there are people from CMHC here, and I think that this is something that really should go into the training manuals, this idea that housing is not forever and people move, and that's not a bad thing. So that was something that there were some misunderstandings about. There were mitigating measures for the long stays in hotels. There were programs that were set up in different cities to connect people with schools, to get organized for the choice of schools, to know how the system worked. And in at least one city, they actually did manage to get people into schools, even if they were still in the hotels, which was quite astonishing, really. And then a lot of programs to connect people with local recreational services and so on. Where there were some missed opportunities was to get people into other settlement programs while they were waiting, especially language training. And some people said that with hindsight, if there was a way that could have been, they could have done more to get people started earlier on the language training. That would have been a good thing to do. Affordability, this is obviously the really huge piece, and there are two slides about this. The first one is that because of the number of large families and the large volume in a short space of time in some cities, the Syrian operation spotlighted something that we already knew, which was the inadequacy of the RAP rates relative to market rents. But something else happened while the operation was going on, which actually mitigated things for people who had larger families. The child benefit was changed with the April 2016 budget, and then that was introduced over the coming months. and it made housing a bit less unaffordable, especially for larger families, but there was often a 3-month wait for newcomers to access the child benefit. It wasn't in the regulations, but that was just the way things worked out. So we tried to work out some of the effects of different housing markets and the effects of the child benefit. We're hoping to do this in more detail for our final report, but we have very limited information because the calculations are complicated. The RAP organizations do not yet have an online tool for calculating what people are eligible for, although this has been promised to them. It hasn't happened yet. And the data are not public either. So we were given some data about different configurations and what the costs would be, and we tried to use it, but this is incomplete. So the first thing I wanted to do was kind of control over the province, because one province like Ontario, the child benefit rates are the same in the whole province, and there may be slight differences in the RAP rate from city to city, but I don't have that information, so I just assumed that the rate was about the same. And if we take, you know, a fairly average, slightly larger than normal family for Canada, very normal for people from many countries, 2 parents and 3 kids, one preschool kid and 2 adolescent and pre-adolescent, and let's say they have a 3-bedroom apartment, and they get RAP and they get the child benefit. In the Toronto metropolitan area, they will be spending not far off 50% of their combined income for rent. If they also get a transportation allowance. I'm not quite sure how much that is, but if they also use that transportation allowance to help pay their rent, they'll reduce their rent ratio. But then will they have enough money to do the essential things that they have to spend transit fares on? If they went to Windsor, and I am using the 2016 rent rates for Windsor, if there's anybody here listening from Windsor. If they went to Windsor, however, they would not be in as difficult a situation because they'd only be spending 32% of their income for rent. However, these rent levels don't include utilities. And when we calculate affordability, we include the essential utilities in there, and these rent levels don't include utilities. Okay, then we look at people who don't get child benefits. So those would be either couples or single adults. I kind of arbitrarily chose the case of Calgary because it's in the middle. It used to be a higher rent city, but fortunately for our GARs and not so fortunately for the Calgary economy, vacancy rates have increased in Calgary, and so rents are more negotiable. So Calgary ends up being a very average kind of case. So a couple with no children who live in a 1-bedroom apartment are still paying 74% of their RAP allowance for rent. If they're a single adult, they are really out of luck because 95% of their RAP allowance is needed to get them into a bachelor apartment, which means that if they do not have some other source of subsidy, they are not in a bachelor apartment. They are sharing with other people, or they're lodging in somebody's house, or we don't really know what they're doing. And we actually need to know more about the single people. They might not have formed a large number of the proportion of the people in the Syrian cohort, but they are very low income, and even after getting all getting the supplements, and sometimes they are very high needs and very isolated. So that's something that we really need to think about. Okay, the second part of the affordability is all the amazing range of strategies and resources that organizations deployed to actually make this work. Everybody was housed. Nobody ever waited longer than 3 months. Affordable housing was found by one way, means or another for everyone, which was quite an amazing outcome. Probably the single most important mechanism, very prevalent in many cities, was negotiating rent reductions with private landlords. But it wasn't possible everywhere. It wasn't possible in cities where rents were universally high. It was possible in cities where rents were fairly high, but there were segments of the market that were kind of less desirable, where vacancy rates were higher, and then things became more negotiable. So you see where this issue of working with landlords that you already know and with whom you have a relationship of trust and a certain amount of negotiating and bargaining power where that really kicks in. It was absolutely crucial. Then another aspect was ad hoc rent supplementation. And the major source of this ad hoc rent supplementation was the donations that came from the private sector that the federal government coordinated and asked Community Foundations of Canada to distribute in local communities through the local community foundation or United Way, and that was called the Welcome Fund. And I won't go into details about that here, but basically it was a very intense and interesting experience, as much for the people who organized it as the people who received the donations. And basically, organizations were offered a donation that was based on the proportion of Canada's refugees that they, government-assisted refugees that they were taking in, but they were allowed flexibility to determine who were the most needy cases. Now, it wasn't always used for housing, but when it was used for housing, that was most of the time. Basically, local organizations were able to negotiate for whom they would use it, figure out who in their particular local context was most in need, and it varied, see? So if it was mostly large families that they had to help, but those large families had to wait 3 months for their child benefit, they would use the Welcome Fund to help bridge that gap. And then afterwards, they would use the Welcome Fund for people who didn't get child benefit. So there were different things that were used, but basically the idea was to kind of use the money when and for whom and when it was the most needed. Certain cities and provinces have municipal and provincial rent supplement programs, which, where they existed, made a huge difference, but that was not widespread. And one of those programs was abolished during the Syrian operation. So those programs are subject to, they're not stable, but where they existed, they were very useful. To our surprise, there was not a huge amount of access to rent geared to income social housing, but there was more than what we were expecting. We thought that everybody would tell us, oh, you know, no chance, long waiting list, nobody has any hope of getting into social housing, rent geared to income during the first year. But in fact, it did happen in some cities. It was a matter of particular local supply context. There might have been one housing project that had a higher vacancy rate for X, Y, or Z reason. Different provinces have different interpretations of how they implement the principle of housing people who have the most priority needs. Some provinces have no residency criteria before you can wait on the waiting list. Our worst case example is Quebec, where they were very, very intransigent about that. There was no change made, no question that people could be even registered on the waiting list during the first year, and there were in between scenarios for that. There were some people that were housed after a number of months, or even after a number of weeks in a few cases, in provincial public housing. There were some people that went into non-market social housing that could be municipal, but they got a rent supplement for it. So that's mixed income housing. And there were even some people that went into co-op housing, which has more flexibility in terms of selection, but also in terms of how they operate their waiting list. But it's based on suitable. You can't get into a co-op unless you're deemed suitable. So people who were considered very high needs refugees who really did not have time to learn how to fix, do household maintenance or do accounts certainly wouldn't have gone into co-op housing, but some people did go into co-op housing, and it's very interesting that happened, and it would be good to know more about that. Quality issues for social housing. There's a big potential issue, although it didn't kind of come up in the context of the Syrian operation in the first 12 months, but we shouldn't forget it. Overall, newcomers, and especially refugee newcomers, rely on the aging private rental stock that exists in most of our cities to get reasonably affordable rent. It's not cheap, but it's more affordable than either the stock that's being that's disappearing because of gentrification or the newer the newer higher quality stock. So there are issues of under maintenance and therefore potential adequacy. Less desirable buildings have higher vacancy rates and therefore more negotiable rents, and those exist in many cities. Those less desirable buildings might still be of quite good quality, or they might be of not so good quality. It depends. What actually happened was that, again, is this issue of the long-standing relationships with landlords. This, according to our interviewees, had a positive effect on the quality of GAR's first housing. And the corollary to that is you can make a hypothesis that people who were trying to find housing for people but who were not connected to these landlords, that were used to working with refugees and were willing to give the refugees their good housing, they might have not had such good housing outcomes, but we don't know. And that's another reason why it would be good to look at, to follow privately sponsored refugees who might not have had those same connections. However, there were some problems. I haven't put it in orange because I don't think it happened in a lot of cities, but there were issues with infestations and so on that were greater in cities where the RAP providers had to start dealing with, not necessarily with unknown landlords, but with new housing inventory where the history of the building wasn't known. And so there were some nasty surprises, and so contingency fund had to be used to move people out. So that's something that didn't happen too often with the Syrian operation, but it could happen more in the future, and it's always something that has to be surveilled. There was at least one case where there was this idea that people are used to living in houses. Let's try to get them into houses rather than making them live in high-rise apartments. So sometimes the contingency fund was used to try to get the five-bedroom family houses for very large families, and in cities like Calgary that is actually doable, especially in the current market. So that was interesting. Training and experience of housing search workers, that's absolutely crucial, because the housing search workers have to make judgment calls about quality of the housing, about making sure that it's the landlord that understands about various different cultural issues and that understands that the RAP income is not a high income, but it's a steady income and that people are going to get their child benefit. So the housing search workers have to do all that kind of coordination. And there were shortages of time and shortages of resources for training the housing search workers in some cities during the peak period. Suitability of housing. So suitability, I'm using I'm using Canada Mortgage and Housing concept of suitability, which is really to do with is the housing the right size for the household. So the big issue is, well, when you have low vacancy rates, one of the challenges was convincing landlords to rent units to people with 4 or 5 children under 5. That came up over and over again. In some housing markets, it was possible to persuade landlords to connect 2 smaller housing units to make 1. In some cities, it was loans were made available by the credit union to increase the housing supply, for instance, to do essential work to make basement suites legal. However, another interviewee said, don't even think about putting them in basements because basements can evoke trauma. So it probably depended on who you got and what those people's experiences was. So one size doesn't fit all. There was a lot of outreach to and from grassroots individuals and organizations to find ways of expanding the housing supply. But it raises the issue of making sure that effort is well spent by communicating what's needed in terms of additional housing. So when you had groups that were offering, you can have a room in my apartment for a month or whatever, that's not appropriate for refugee resettlement because they need something stable. So pretty soon that message was learned, and community and city collaborations were set up for better tools, and housing portals were set up in different cities. The largest one is in Toronto, and I think those people might be online with us, but there were others that were done in other cities. Suitability for us and for our providers also involves a suitable location and place. There was one really, really telling quote about if you put them out in an isolated area, they're isolated, and that will reinforce mental health challenges, and so putting in efforts to get the right housing in the right place. So there's the issue of social networks and neighborhoods. There was a strong effort to keep groups of friends together, to move 3 or 4 families to the same housing complex, for instance. Spatial concentrations within the same housing complex. Some interviewees had reservations about that because they were afraid that it would have negative impacts on integration, but we had examples where that actually turned out to be a very interesting practice, where it helped with various aspects of resettlement, as people were encouraged to get involved in making improvements to a disadvantaged neighborhood or a community. So again, that's a case-by-case issue. The issue of proximity to health services, access to settlement programs, and also the whole issue of how you're going to make public transit affordable. That was something that was done with, you know, more or less effectiveness in different cities. Housing stability, and what we mean by that is that kind of ongoing support after people have had that initial coaching in their REP program to keep their housing for the first year, and, you know, have a plan for keeping it after the end of the first year. Or if they need be, if housing stability isn't possible, that they can move out and go somewhere else where they're going to be able to start building stability. So it came up many times that many people needed accompaniment for living well in rental housing because they're not used to this. They might be more used to this, which is a house, but it's a row house. It's still row housing. It's still a very different kind of housing environment, and you can see that this one has a lot of public space and semi-public space, and that was often the case. You could also have semi-public space in apartment building corridors, or the green space in between garden homes, which some cities have, and who does that belong to? It's kind of like a no person's land. And so there were issues of, especially relating to child supervision in semi-public places, and it has to do with people's previous experience. If they lived in small towns or in villages, there are different models of child supervision, and so there wasn't always a realization right away that there needed to be kind of coaching and accompaniment for making that work. So in some cities, housing support workers were constantly available in places like this to help out with issues that would arise. But and there were also in some provinces there's something called ready to rent programs, or other places. I think it started in smaller communities but has now spread to larger cities. Volunteer support groups, or sometimes called welcome groups, that contribute to these kinds of programs, but it's not available everywhere. For instance, there's a program that's paid for by IRCC, but only in Ontario, and it's called in parts of Ontario, and it's called Client Support Services, and that, where that program exists, it includes the possibility of funding this kind of wraparound support for housing. But those types of programs don't exist everywhere, and that's something to think about as to whether they should exist everywhere. Okay. I already mentioned fostering newcomer involvement in neighborhood improvement. That's a way of helping people to stay put and live well in their housing, and develop some sort of more subtle forms of integration over and up beyond the formal aspects. Contingency monies were used to help people stay put if there was some sort of a crisis that led to rent arrears, or to help people move out if there was a problem with their housing, with bugs, for instance, and it couldn't be fixed, and people would move and they would lose their rental deposit. The issue of month 13, I'm going to go through really quickly because it turned out not to be an issue, which was actually quite interesting. So month 13 issue referred to the idea that there would be this drop in income support in some provinces when people were no longer labelled as government-assisted refugees, and they were just like any other immigrant newcomer, and they were if they didn't have if they were not self-supporting, they were eligible like other people who have who were not self-supporting, they were eligible for provincial social assistance. So in some provinces, because of the way it was calculated and the loss of certain specific allowances for refugees, in some provinces there was a loss of monthly allowances that could amount to a couple $100 or more. And there was a loss of a separate allocation for young adult children because of the different definition of adult in federal law and provincial law. In practice, the adjustment problems were largely preempted. There were cities where they already planned for month 13 when they were negotiating the rents for the first housing, with the idea that people would stay put, the lease would be renewed, and there wouldn't be a rent increase more than the rate of inflation, and maybe there wouldn't be a rent increase. There was a lot of coaching that was done, like 3 months before, 2-3 months before month 13, coaching the GARs, liaising with provinces to help make it work smoothly. Sometimes the Welcome Fund monies were kept reserved for helping the transition. There was what we could call just-in-case planning, which means people were given the option to switch to a monthly lease after 12 months. A big point here, which I should have put in the takeaways, but I didn't. No month 13 issue when people are already in rent geared to income housing, because if your income drops, so does your rent. So those people, you know, were in a advantageous situation. A cross-cutting issue is to do with volunteering. Another very felicitous quote from one of our interviewees was channeling unformed volunteer energy. So the people who are listening here in a second language, unformed, it's not the same thing as formé in French. It doesn't mean untrained. It means that they weren't focused. They were kind of in an undetermined shape, and they needed to be channeled so that they would be the most effective. And that happened because there were a lot of new volunteer groups and individuals that were desperate to help with the Syrian operation, and sometimes they didn't really know how. And they made many contributions to resettlement, including the housing aspects. There were different things that happened where volunteer groups would facilitate daily life and in temporary accommodation would normalize it in terms of helping to make sure people got the right food, for example. Different types of contributions to housing search, like without thinking that the volunteers would have the same training as the experienced housing search workers, they helped in different ways. There was one example where in a very large city, there were new neighborhoods where housing was coming on stream, and it would be like a 1.5-hour trip from where the RAT provider was located. So there was help with public transportation and by the volunteers, and helping with people to learn about new neighborhoods and stuff. Volunteers helped with logistics for donated household items that turned up on the doorsteps of you know, relatively small suites where the settlement organizations were located. And there was collaboration of the welcome support groups that were being formed with the service providers. The challenges this created was that this was a huge amount of extra work for the service provider organizations at the busiest time, because they had to train the volunteers, they had to coordinate them, and they had to manage all the donations. So that was kind of a really important missing piece that would have to be worked on for a future operation. Improving the information flow to help orient volunteers so that they can figure out how best they can help with housing. And then there was an issue in some cases of kind of working out protocols to figure out who does what, to avoid people kind of stepping on other people's territory, which is not just kind of an ego thing, but there can be real issues with boundary crossing. But everybody said that this was a huge learning experience. There were RAT providers that had not had a lot of experience really integrating volunteers before, and they started doing it with the Syrian operation, and they are building on that now, and they will do it more next time, and people told us about that. Housing issues relating to private sponsorship, very quickly. I hope I'm not losing people because we've taken an hour already. We're just scratching at the surface, and so these are issues really for future research. There's a difference between whether private sponsors are sponsored by an organization or a group that includes family members or is part of an established Syrian community, and where it was entirely or or mainly, you know, middle-class university professors. It's not the same thing, and we can't make any judgment calls about the outcomes one way or the other. But if research is going to be done on it, there's a distinction that needs to be made. And I would, you know, if we're going to do future research, that would be a very interesting thing to look at. What people did tell us is that with the Syrian operation, there were a lot of new sponsor groups that had never done this before, and they were very inexperienced with rental housing systems. Because of all this goodwill and kind of desperate to help people from their extended families or extended transnational communities, people didn't really always realize what kind of financial commitment they were taking on. Because I read all the fine print that said you've got to provide, you know, this amount of money, which is the same as the provincial social assistance rate, but they didn't realize that they couldn't actually put people in market rental housing with that budget, and so they had to find ways of spending more money to pay for people's housing, and we don't know how that worked, and we don't know what happened in month 13 either for people in that situation. Service provider organizations very often had to help sponsors, and sometimes it happened through that formal mechanism of the sponsorship agreement holder, and sometimes it happened in a more informal way because a need sprang up and that organization had expertise. There was also a whole rush of new private sponsors by people who were private sponsorship by the government, sponsored refugees, some of whom were able, after a number of months, to sponsor an additional family member, and that has to be organized. So some sponsorship agreement holders needed to collect ad hoc donations, but the really big difference here is between Quebec and the rest of Canada, because in Quebec there is no refugee sponsorship training program. So there's no infrastructure or guaranteed financial support for that. In the rest of Canada, because of the numbers involved, there wasn't always enough money, but there was an infrastructure and there was a process. Here where we are in Quebec, there's no refugee sponsorship training program whatsoever, and so there we have an issue. We have an issue here in Quebec as to what to do about that. There's also a question of how effective is the outreach that's available to private sponsors? When there's a training program in place, how many people does it reach? Are there sponsors who fall between the cracks? That's something that we really don't know. Okay, in conclusion, this study, which is not quite finished, but it's getting there, has strengths and limitations. We have a large and representative sample of RAP service providers, including one from the equivalent in Quebec. We were trying to get two, but a second one accepted, but for whatever reason that interview just didn't happen. We have a variety of city types, we have a variety of housing market conditions, and that means different urban contexts of refugee reception. And another strength is that we're integrating different data sources into an integrated database to look at all these issues. The two main limitations are that people who were government-assisted refugees, yes, they worked with they were the clients of the RAP provider, but after the RAP services were over, they may have used other housing services that were provided by other settlement organizations. They may not have. And in that case, we don't know anything about it because we didn't interview any of the other organizations. We didn't have the chance to do so, but in future research, that would be interesting. And then, as I said before, all we can do for privately sponsored refugees issues in this study is to scratch the surface to raise issues for future research. So there's the two final takeaways. We were not yet synthetic enough that we can put this into one slide, which you're supposed to do with a takeaway. But the first one here is local level advanced planning. Good or better information about arrival timing and refugee profiles. Without that, you can't make the local level advanced planning work. And also the need to work out all stakeholders' roles, including volunteers, to sort that out ahead of time. Who does what, when, and the issue of managing refugees' expectations in housing as in other areas, it needs to begin with pre-arrival training and then different ways of reinforcing it in an ongoing way to assist people in making wise housing choices. Housing stability, as I said before, wraparound supports are needed throughout year one for the housing stability and to help people move into year two. Finally, the question of housing affordability, it's become a structural problem because rents are not going to go down in most of Canada's high rent cities. The structural aspect won't change unless there's a big investment in not-for-profit rental housing. And Canada has a long-term commitment to accepting high-needs refugees. So it's going to happen over and over and over again that people will be on income assistance for a long period of time. There may not be as many of them if the next set of operations are not as big as the Syrian refugees, but it's going to keep on happening. So in that sense, it's a structural problem. In many cities, it was resolved for the Syrian case with ad hoc solutions. The Welcome Fund was created deliberately by the federal government because the federal government knew it was going to be a problem. And they knew that corporate donors wanted to help, and this was considered to be a good way of using this help in the circumstances. But the fact remains that it was ad hoc, and you have no idea if it can be repeated in future occasions, or if there's going to be like donor fatigue, is a phrase that's sometimes used. If that doesn't happen, there is the question of ethics and equity of targeted contributions. There were a lot of problems connected with the fact that there was this and that parcel of money. There was the Welcome Fund, but there was also smaller stuff like supermarket chains saying, okay, we're going to give $50 vouchers to the Syrians. Well, then there were organizations that said, you can see me because you're on video. What about us? We've got, 20% of our refugees that we have we're helping are not Syrians. Well, what am I going to say to that 20%? So that issue arose quite often. And then the child benefit, that is not specific to refugees, but it is specific to people who have kids. So what about the people who don't have children? Is it a good idea to depend on the Canada Child Benefit to make the rents affordable? I know that there are different views out there about that, and so it has to be an ongoing conversation. And the question of access to rent-geared income housing, it's clearly a sustainable solution for refugees that need medium-term income support. The question is are there ways of making enough of it available? That's a broader question. It doesn't just affect refugees, it affects anybody that needs medium-term income support. But I do come back to the paradox of the fact that people who are known to have medium-term needs, and yet their income support is tied to a program. It's supposed to be for short-term financial crisis. Tying it to the provincial social assistance model is a problem. It's a puzzle, and that affects government-assisted refugees, but it affects some other groups in our society as well. But here we're talking about it in the context of refugees. So thank you very much for listening for a lot longer than I was planning. Thank you to the Sixth Start for refugee hosting. Thank you to 16 interviewees and 14 newcomer serving organizations, because we had 2 double interviews. Thank you to Sarah Lyons from the Community Foundations of Canada for explaining to us how the Welcome Fund worked. Thank you to our project team collaborators who advised us with some aspects of this project. Valerie Preston from York University and Kathy Shower from ISS of BC. Thank you to our 2 student transcribers, Robert and Christine. And for those of you who have to run away right off now to a meeting because I've overrun my time, this is being recorded and the PDF file will be available, and everybody that is registered will automatically receive a link, and I will double check and make sure that you get it. And if you have any colleagues that want the link, you just let me know, and I will send the link to you. So this is it for the presentation, and Philip is the technician here at D6 is going to organize getting people online at least in writing to ask questions. We don't have the resources to have all the have an in-person discussion, unfortunately. Et c'est sûr que pour les participants montréalais, soyez libres de poser les questions dans la langue de votre choix. Et puis, si c'est une question qui a de la pertinence pour le reste du monde, dans le reste du Canada, if your question is relevant for everybody that's listening to this, we'll improvise translation.
Yeah, so we already have a couple of questions. I'll start with one. So it's from Alvaro Moreno. In Victoria, we recommended changes in the public housing regulations to accommodate cultural customs regarding children of different sex sharing a bedroom or children of various ages sharing bedrooms. How did this affect housing in other cities?
I've got a very short and disappointing answer. I don't know, but this is something that would be very interesting to look into. We the social housing providers are strictly supposed to follow the national occupancy norms, which are enforced by the provinces. I really don't know what if any flexibility was included for those types of negotiations, but the point is absolutely important, and it's something that we will make a note of for the final report. But it's not something that we know about. It's kind of like it's a fine but very important detail. This was kind of evolving process. As we were doing the interviews, we discovered that social housing was actually people were actually being placed in social housing. Our initial view was biased by the national media and by the federal government spokespeople, which said that this is all going to be private solutions. Private landlords will help, private donations will help pay for private housing, and it was kind of not on our radar that people would actually be able to get into social housing, and we discovered it along the route. And I think if we had more time for this project, it would be great to actually add on some interviews for those cities where provincial housing providers did get on board. One thing I did hear about was in an interview was that in one province there was an interpretation that was made of the definition of homelessness, because homeless people have high priority for social housing. So there was an argument made that we are applying our rules in a completely fair and transparent way. We are not giving priority to one group of needy people over another group of people that are equally needy. We are giving priority to homeless people, and just so happens we've got several dozen families that have arrived in our city that are homeless, and we've got this housing we can put them in. And so that was another example of the kind of flexibility that was made. But I'm sorry I can't answer your question, but it is a very good question.
Okay, so we have another question. It's from Joanne Sans-Chagrin. Were places of arrival the place of settlement, or the place of settlement was already planned before arrival?
Okay, Joanne Chagrin, I know that you're from CMHC, and there are, if I get this wrong, there are people from IRCC online which are who will definitely jump in and correct me. And then Philippe, we have a question from the room here. There's one person in the room who also wants to ask a question, n'est-ce pas? So we'll go to Miriam afterwards. What happened was people were initially everybody initially arrived in Toronto and Montreal, and that was very quickly it was planned and organized by IRCC with their branch within IRCC that matches people to appropriate destinations. So appropriate destinations is in terms of the capacity of that city to take in refugees that have kind of that particular bundle of needs, and the housing infrastructure of that city is supposed to come into play, but it didn't really come into play for the reasons that we've already discussed, the kind of rushed nature of the operation and the lack of information until the last minute about family sizes. And they're also supposed to consider where, if people have some family members in that city to go there. And then, but then there were, I think RCC will correct me, but there was a model that was the most common where people would then move to the city where they would settle. But there was a model then, there was another model that was applied in BC and to a lesser extent in Alberta, where they would go to that province's largest city, and there would be, it was called a hub and spoke model. So I won't go into all the details, but they would be destined to a smaller city, and there would be coordination with the RAP organizations involving that. And there were other fine details in BC which we do know about, but we won't go into detail. And then there was another model that was called the New Brunswick Model, and it was implemented for part of the operation, where a lot of people were moved into a hotel complex outside of a major city in New Brunswick, and they were given an accelerated program for RAP, and RAP providers from the different cities participated in that program, and then people were moved out from there to the different cities. So those were the three models, but the most prevalent one was that they would go to the, they would be destined to that city. And if there's anybody from IRCC that wants to correct me right away, please jump in. Otherwise, I'll ask. I know that Miriam here wants to ask a question. Is it okay? Okay. I guess I didn't get that wrong. Okay. Miriam, who is from the potentially.
Sorry, we cannot hear you. We'll have to use the microphone in the room.
Oui, tu parles français. Oui. Je vais traduire s'il y a quelque chose qu'il faut traduire.
Donc,
oui.
Myriam Richard, je suis agent de recherche à la table de concertation des organismes au service des personnes réfugiées et migrantes, TCRI, et à l'Université de Montréal. Et en fait, ma question est par rapport à quelque chose que tu as mentionné, Damaris, à propos des enjeux ou des conflits entre les nouvelles interventions municipales, provinciales et les services existants. Je me demandais si on pouvait avoir quelques exemples ou avoir un petit peu plus de détails là-dessus. Puis j'aurais une deuxième question aussi qui serait à propos si vous avez entendu, s'il y a des résultats qui sont sortis à propos de, disons, plutôt sur les réseaux plus informels, par exemple, que ce soit, bon, là, moi, je participe à un projet qui est aussi avec la même subvention pour, en fait, les réfugiés, réfugiés parrainés, donc avec la TCRI, l'Université de Montréal, et c'est une chose qui ressort des entrevues, l'utilisation, par exemple, de groupes Internet, Facebook, etc. Est-ce que c'est des choses que vous avez, qui ont émergé dans vos résultats?
So there are three questions here, and I'm not sure if I'm going to remember them all, but the first one was, could we say a little bit more about the issues where there were provincial or municipal interventions that kind of jumped into a process that was already in place, and was there duplication and overlap of efforts? We heard of a couple of examples where that happened, and I don't want to name the cities, and we're not going to name the cities in our report, and the reason for that is that we don't have everybody's point of view on that. We only have some organizations' point of view. But what we heard about what happened was that a few months after the whole coordination table process had been set up, the municipality kind of jumped in and said, me too, me too. And the organization had, well, you know, we've already done this. So there was kind of like there was an overlap there. And the other example that we heard about was a provincial example where a contract was given for an aspect of wraparound support accompaniment where maybe that was already being done by another organization, or there were issues about whether it was given to the people who were the most well trained for it. And that's really all I can say, because there's an issue of confidentiality, given that we don't have full information. So in our report, we under our confidentiality agreement, we are going to name this. We have to name the cities where we interviewed, because that's a methodological issue in terms of showing that it was representative. And for things that we think were really best practices that could be shared and emulated, sometimes they're known already, but we're certainly going to name the cities then. But when there were issues that were kind of problematic, but we don't have 100% of the story, we are not going to name the cities. So there was the third question was about whether, and you'll have to remind me about the second because I've forgotten it. Okay. Really, all that we know about what we know about informal networks is what we pick up from the other part of our data, which is that we have this huge media file. There are a lot of informal reports about networks, informal networks, and some people who spoke to the parliamentary hearings talked about that too. Alexandra, tu donnes le micro? Yeah. 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 Exactly. Yeah, I mean, we didn't even try to talk to refugees. Our interest was in how the process of finding people housing was organized, right? But and how it worked out. But in terms of how it worked out, we only have from direct interviews, we only have the perspective of the people who organized it. So the only way we can pick up on other perspectives and also find out about the informal networks is from the media coverage, some of which is really fantastic. When there's all these little local examples that you get, but a challenge for us is we got a lot of information about that, and there's a saying in the research community that 100 anecdotes don't make data, but we disagree with that, because if you really organize all those anecdotes and you relate those to systematic research, you can actually help turn some of those anecdotes into data. And so we think that we are picking up on stuff from the media sources, and also from some of the evidence to committees that will help fill that in a little bit, but it's not systematic information. Any of these things could form the object of a whole research project on their own. Et ta troisième question? Okay, c'était tout. Okay. Merci beaucoup, Myriam.
Je vais continuer avec une question en ligne. So another question from Cody Gunter. Do you know if many or few Syrians moved from their first permanent home to a different home within their first year in Canada?
Yeah, that's called secondary migration, and we asked a question about that. In terms of its impacts on housing, it turned out to be a smaller issue than we initially feared, and so we will be mentioning it in our report, but it wasn't a big issue. There is a whole process in place that's very well organized, that's in place when people who are under the care of the RAP program, both aspects of it, the income support for a whole year and the actual delivery of the settlement program for 6 weeks. If people move after they've received that RAP program in one city, but while they're still a government-assisted refugee, their file is transferred to the RAP organization in the city that they're moving to, and that RAP organization, monitors things for them. But they're not entitled to get the housing. They're not entitled to get temporary housing again, and they're also not entitled to get a second set of RAP services to help them settle in that particular city. So what those people are supposed to do is they're supposed to go to another organization in that city. They're perfectly entitled to all of the normal resettlement services, but not to the specialized ones for refugees. So there were some cities where that happened, and it tended to be cities where as far as we know, one of the reasons why people moved was because that they heard that there was more affordable housing somewhere else, or they had families somewhere else, or occasionally they even found a job somewhere else. That was very unusual, but you know, there would be a few examples of that. And so housing didn't really come up as an issue, but the documentation exists on those people, and if somebody wanted to develop a research project that was tracking that secondary migration, they would have to contact IRCC, which has all that information in their administrative administrative data. But we thought it was going to create problems of workload overload for the RAP providers, and it didn't, because of this issue of they're not being able to give the same program services twice, and the numbers of secondary migrants were not sufficiently large that it would overload the resources. It wasn't like 200 people coming to a small town and saying, "Hello, I'm here and I need settlement services." The numbers were small enough that they could be very well and adequately served by existing programs. And I think it's a robust finding. I mean, we did interview in 12 cities, so of different sizes. So I think that we got at that adequately. Yeah.
Okay, I have another question from Leila Omar. Thank you so much for this great presentation. You talked about managing expectations and cultural misunderstandings in relation to the idea of housing and owning a house. Would you be able to elaborate on this? What exactly were these expectations? How were they dealt with in general?
Well, one of the expectations was that people in their countries of origin were used to living in a house rather than an apartment, especially those from more rural areas and small towns. There were also urban dwellers many urban dwellers among the refugees, including among the government-assisted refugees, even much more so among the privately sponsored. And those urban dwellers, I mean, it's not the same, but it's the same. They're like urban dwellers everywhere else in some respects. But even then, the issue of moving of expecting to stay in your place for a long time may have been an issue. But the issue of not being used to living in a medium to high density apartment or townhouse complex, the issue that created in terms of neighboring relations was supervision of children. If you come from a place where you can let children run around within a fairly large perimeter and they will be safe, and there's a concept of the community, all the neighbors taking care of them, then it's different from if you come to downtown Hamilton or a 400-unit apartment building in Ottawa. It's just not the same. And so that the issue around supervising children was the biggest one. The issue of expecting to be able to live in a house, I don't know in how many places that came up, but a couple of people did mention it, sort of living in a house rather than an apartment and being disappointed that it was an apartment. But that disappointment has to be linked with the fact that in Canada we have this totally ingrained concept of the housing ladder, and it involves moving up to bigger and better things, and eventually a single family house and the American dream and all that stuff. And some migrants, especially refugees, are used to the idea that you get a house and you stay in it and you improve it and it's your house for life, and so you don't want to agree to live in an apartment or in in a place that you really don't like very much because it's all you can afford, because you don't realize that you can move and it's normal to move. And another aspect of that is that even with the formal training, people are received that they might get it. People are having so much information all at once that they sometimes don't understand that a lease is a legal contract, and you can't suddenly decide to move because you hear through social media that there's a better house that you could move to that your friends have found in another city. If you do that, there are consequences. You're going to lose your deposit, which is a very big issue in all provinces other than Quebec. So those are the types of issues, and there are other minor issues, but that affect everybody who moves into a new place. You know, if you don't know what day recycling goes out, that is not an issue to do with immigration and refugee settlement. It's because you've moved somewhere, or you know, you had a bad day with your kids and you forgot to do it. And actually you have bad days with your kids many days, and so you often forget to do it. So you have to separate out the issues that are really to do with different cultural experiences and the issues that are just to do with just normal issues of everyday life that come up. But I really think there's a role to improve. CMHC produces already very interesting guides for newcomers. We've had discussions before with CMHC in the context of previous projects about how effective those guides are at getting to the right people at the right time. And I think and some of the provinces and even municipalities reproduce those guides, so their own versions of those guides. But I think there are some things to learn from the Syrian operation about how to improve those guides. Handing out information in Arabic did not cut it for a lot of these newcomers because they were not literate in Arabic. So it had to be, and that could happen again with another refugee flow. And so now we have much better tools for oral communication. So thinking about non-written versions of these type of guides, but also repeating the same kind of information and training in different ways at different points throughout the first year would really help people.
Okay, we have another question. This is from Mohamed from the Manitoba Interfaith Immigration Council. He says, thank you for your presentation. The most important problem that we face when we are looking for new accommodation for the Syrian refugee newcomers in Canada, and especially around Winnipeg, is that RAP rates given by the government is not enough. Could you please give us a solution about that, and what are the efforts made by the government to resolve this problem?
It's a very good question. Mohammed, we had two online discussions with the people that we interviewed, including the CEO of your organization, and everybody wants a solution. There are different views within the RAP community, let alone within government, as to what that solution should be. 3 successive evaluation reports of the government-assisted refugee program, done and published and available online by our IRCC, repeat the same question, and a solution has not yet been found. The solution has to be found, and it's a huge policy. It's a huge policy discussion that we can only kind of reiterate or maybe crystallize a little bit. Maybe putting it in the broadest terms, you know, should any people who need income assistance over the longer term, should that be delivered through the existing social assistance program, which is supposed to be aid of last resort? So that definitely applies to a substantial percentage of government-assisted refugees since the 2002 ARPA changes, but it also applies to other groups in society. So right now there's a patchwork of programs that kind of address that problem piecemeal. So allowances for people with different kinds of disabilities. Now we have the child benefit for anybody who has kids and is on a low income, whether or not that's low income because they're on income assistance or low income because they're part of the working poor. There are people who get left out of the current package of measures that are put in place to try to fix that fundamental problem, which is that you can't live on social assistance. You can't live an autonomous life on social assistance without additional supports. And right now, that because of the changes in the child benefit, which were really major, questions of extreme poverty, and therefore meaning not being able to afford housing, among other things, questions of extreme poverty are in the process of dropping for families with children. So the child benefit changes are responding to the goals of many of the groups that have been arguing for, campaigns to end child poverty. But it's not helping people who, there are two problems about that. It's not helping people who don't have children, and in the most expensive housing market, money that's supposed to help families have enough food on the table, some of it's being used to pay rent. So some of the child benefit is being diverted to pay rent, and it's a question of, for governments to decide, is that what you wanted to do when you increased the child benefit, and then what are you going to do for the people who don't have child benefit? So that's one aspect. The other aspect is reinvesting resources into creating housing solutions where the cost of the housing will not depend on your income. So that is the piece of rent geared to income housing. Do we reinvest in expanding the social housing stock that is rent geared to income, which is delivered in different ways? That's the classic public housing, which hasn't been built for 23 years, where all of the housing is rent geared to income. And then there are various mixed income solutions which were quite heavily invested in the late 70s and 1980s, but where there hasn't been a lot of investment in mixed income market, non-market housing, except in Quebec and British Columbia, and only very small amounts elsewhere. And that's housing where some of the people pay a low end of market rent, and some of them receive are in subsidized places. So those housing-based solutions exist, but there's the question of the decision to make use of them. And then there's a secondary issue that I mentioned of making sure that newcomers have fair access to that rent geared to income housing. If you put barriers up in terms of saying, well, you can't even put yourself on the waiting list for a year, then there's an issue there about fair access. But that ball is completely in the court of the provinces, because it's their jurisdiction and they set the rules about eligibility. But even if you're eligible the day after you arrive in Canada, it doesn't help if the waiting list is 5 years long, which is what is the case in a number of the cities where we interviewed, including, I think, Winnipeg. When we did the interview in Winnipeg, nobody was in rent geared to income housing.
That's all the questions I have online for now.
So the questions you have online. Okay, if there are no more questions, thank you for spending so much of your afternoon or morning with us. It's really great to have all this involvement. We have the list of who you are, and for the questions that came in line, we'll have the list of questions and a chat log, and you will all receive information about where you can access the recording of this webinar, and I think it'll be placed on YouTube. There's also going to be a link for the PDF version of the PowerPoint, and all that will be done really soon. And I would really encourage you, when you have the information about the link, to spread the word to people that you know who are unable to attend. And as I mentioned at the beginning, we missed out on the Canadian Housing and Renewal Association's mailing list just due to a problem of timing, and so we really want to reach more housing providers. So anything that you can help us with that networking would be great. Thank you very much indeed again, and goodbye everybody, and I hope we'll have other occasions for some of you. Thank you. Lequel?